ದಿನದ ಮಾತೊಂದ ಬಿಚ್ಚಿಡು ಬಚ್ಚಿಟ್ಟ ಮನದ ಕನಸೊಂದ ಹಿಂದೆ ಸಮಯ ಮುಂದೆ ಇಡಲು ನಮ್ಮ ಹೆಜ್ಜೆಯ ನಿನ್ನ ಸಾಹಸ ರಥಕ್ಕೆ ಸಾರಥಿಯಾಗಿ ಮುನ್ನಡೆಸಿದೆ ನಿನ್ನ ಬಾನಂಗಳ ಕೆಳದೊಯ್ಯುವ ರೆಕ್ಕೆಯಾಗಿ ಕೂಡಿದೆ ಬೆಂಗಳೂರು ವಾಯ್ಸ್ ಬೆಂಗಳೂರು ವಾಯ್ಸ್
Bengaluru Voice. Listen to your heart.
ನಮಸ್ಕಾರ ಗ್ಲೋಬಲ್ ಕನ್ನಡಿಗರೇ, ಬೆಂಗಳೂರು ವಾಯ್ಸ್ನ 415ನೇ ಸಂಚಿಕೆಗೆ ನಿಮ್ಮೆಲ್ಲರಿಗೂ ಸ್ವಾಗತ ಸುಸ್ವಾಗತ. ಸ್ನೇಹಿತರೆ, ಹೇಗಿದ್ದೀರಾ? ಸಮ್ಮರು ತುಂಬ ಬ್ಯುಸಿ ಇರಬೇಕು ನಿಮಗೆ, ಬೋತ್ ಅಟ್ ಆಫೀಸ್ ಆ್ಯಂಡ್ ಔಟ್ಸೈಡ್ ದ ಆಫೀಸ್. ಕೆಲವು ರಜೆ ತಗೊಂಡಿದ್ದೀರಾ, ಆದರೂ ಕೂಡ ತಪ್ಪದೆ ನಮ್ಮ ಬೆಂಗಳೂರು ವಾಯ್ಸ್ ಕಾರ್ಯಕ್ರಮಕ್ಕೆ ಟ್ಯೂನ್ ಮಾಡಿದ್ದಕ್ಕೆ ಬಹಳ ಧನ್ಯವಾದಗಳು. 415ನೇ ಸಂಚಿಕೆಗೆ ಬರಮಾಡ್ಕೊಳ್ತಾ ಇದ್ದೀವಿ. ಬೆಂಗಳೂರು ವಾಯ್ಸ್ನ ತಂಡ ಗೋವರ್ಧನ್ ಗೌಡ, ರವಿ ಪಾಂಗಾಲ್, ವಿನೋದ್ ಕುಮಾರ್, ತೇಜಸ್, ಆರ್ಜೆಗಳಾದ ರಮ್ಯಾ ಅಭಿಜಿತ್, ರಮ್ಯಾ ವೆಂಕಟೇಶ್, ಪೃಥ್ವಿ, ದಿಲೀಪ್ ಹಾಗೂ ದೇವದತ್ತ. ಇವಾಗ ತಾನೇ ನಾಗರ ಪಂಚಮಿ ಮುಗಿಸಿದ್ರ ಅಂತ ಅನ್ಕೊಳ್ತೀನಿ. ಮುಗಿಸಿ ಇವತ್ತಿನ ದಿವಸ ಬೆಳಗ್ಗೆ ಎದ್ದು ಟ್ಯೂನ್ ಮಾಡಿದ್ದೀರಾ. ಒಳ್ಳೆ ಕಾರ್ಯಕ್ರಮ ಖಂಡಿತ ಕೊಡ್ತೀವಿ ಇವತ್ತು. ಸೊ ಪ್ಲೀಸ್ ಸ್ಟೇ ವಿತ್ ಅಸ್ ಥ್ರೂ ದ ಪ್ರೋಗ್ರಾಮ್ ಟು ಲಿಸನ್ ಟು ದಿಸ್ ಗ್ರೇಟ್ ಎಪಿಸೋಡ್. ಇವತ್ತಿನ ದಿವಸ ನಾವು ಬೆಂಗಳೂರು ವಾಯ್ಸ್ ಕಡೆಯಿಂದ ನಮ್ಮ ಆರೋಗ್ಯ ಸಂಚಿಕೆ 2024 ಸಾಲಿನ ಆರೋಗ್ಯ ಸಂಚಿಕೆ ಶುರು ಮಾಡ್ತಿದ್ದೀವಿ. ವಿ ಪ್ರೌಡ್ ಟು ಅನೌನ್ಸ್ ಸ್ಟಾರ್ಟ್ ಆಫ್ ದ ಹೆಲ್ತ್ ಸೀರೀಸ್ ಫಾರ್ 2024. So we have lined up great professionals in the field of medicine for you for the next 4 weeks. ಇದರಿಂದ ನಿಮಗೆ ಬಹಳ ಮಾಹಿತಿಗಳು ಸಿಗುತ್ತೆ, ಮತ್ತೆ ನಿಮಗೆ ಆರೋಗ್ಯನ ಕಾಪಾಡಿಕೊಳ್ಳುವ ಬಗ್ಗೆ ಎಲ್ಲ ಥರದ ಟೆಕ್ನಿಕ್ಗಳು ತಿಳಿಸುತ್ತೆ. ಅದೇ ಅಲ್ಲದೆ ಬರೀ ಮೆಡಿಕಲ್ ಸೀಮಿತವಾಗಲ್ಲದೆ ಈ ಒಂದು ಸಾಧಕರಿಂದ ಅದರ ಹೆಚ್ಚಿನ ಸಂಗತಿಗಳು ನಿಮಗೆ ತಿಳಿಯುತ್ತೆ. ಇವತ್ತಿನ ದಿವಸ ಈ ಸಂಚಿಕೆ ಮೊದಲನೇ ಅತಿಥಿಯಾಗಿ ನಾವು ಬರಮಾಡ್ಕೊಳ್ತಿದ್ದೀವಿ ಡಾಕ್ಟರ್ ನಂದೀಶ್ ವೀರಪ್ಪ. ಅವ್ರನ್ನ ಬರಮಾಡ್ಕೊಳ್ಳೋಕೆ ಮುಂಚೆ ಒಂದು ಚಿಕ್ಕ ಪರಿಚಯ. ಡಾಕ್ಟರ್ ನಂದೀಶ್ ವೀರಪ್ಪ ಅವರು ತುಂಬ ಹೆಸರುವಾಸಿ. ನಮ್ಮ ಕ್ಯಾಲಿಫೋರ್ನಿಯಾದ ಸೆಂಟ್ರಲ್ ವ್ಯಾಲಿ ಹಾಗೂ ಟ್ರೈ ವ್ಯಾಲಿ ಪ್ರಾಂತ್ಯದಲ್ಲಿ ತುಂಬ ಹೆಸರುವಾಸಿಯಾದಂಥ ಡಾಕ್ಟರ್. ನಿಮಗೆ ಇಂಡಿಯಾನಲ್ಲಿ ಒಂದು ಪ್ರತೀತಿ ಇರುತ್ತೆ, ಏನಂದರೆ ಕೈಗುಣ ಅಂತ. ಡಾಕ್ಟರ್ ಬರೀ ಮಾತಾಡೋ ಸಾಕು ವಾಸಿ ಆಗೋಗ್ಬಿಡುತ್ತೆ. ಸುಮ್ಮನೆ ಬಂದು ಅವ್ರು ಕೈ ಇಟ್ಕೊಂಡು ಏನು ಮೆಡಿಸಿನ್ ಏನು ಕೊಡ್ತಾರೋ ಗೊತ್ತಿಲ್ಲ, ಅವರು ಮಾತಾಡೋದ್ರಿಂದ ಅವ್ರ ಒಡನಾಟದಿಂದ ನಿಮಗೆ ರೋಗ ವಾಸಿ ಆಗುತ್ತೆ. ಐ ಗೆಸ್ ದೇರ್ಸ್ ಅ ಸೈನ್ಸ್ ಬಿಹೈಂಡ್ ಇಟ್ ಟು. ಸೊ ಆ ರೀತಿ ಹೆಸರುವಾಸಿಯಾದಂಥ ಒಬ್ಬ ಡಾಕ್ಟರ್ ಅವರು ನಂದೀಶ್ ವೀರಪ್ಪ ಅವರು ಫ್ಯಾಮಿಲಿ ಹೆಲ್ತ್ ಕೇರ್ Modesto ಇರುವಂಥ ಸಂಸ್ಥೆಯಲ್ಲಿ ಕೆಲಸ ಮಾಡ್ತಾರೆ. ಹೀಸ್ ಎ ಫ್ಯಾಮಿಲಿ ಪ್ರಾಕ್ಟೀಸ್ ಫಿಸಿಷಿಯನ್, ಹ್ಯಾಸ್ ಬೀನ್ ವರ್ಕಿಂಗ್ ಫಾರ್ few decades already. He's also a partner of that one. ಅಲ್ಲಿ ಕೆಲಸ ಮಾಡ್ತಾರೆ. ಅದಲ್ಲದೆ ಅವರು ಕಮ್ಯುನಿಟಿ ಹೆಲ್ತ್ ಸೆಂಟರ್ ಆಫ್ ಅಮೇರಿಕಾ ಅದರ CMO ಕೂಡ ಆಗಿದ್ದಾರೆ, ಚೀಫ್ ಮೆಡಿಕಲ್ ಆಫೀಸರ್ ಕೂಡ ಆಗಿದ್ದಾರೆ. ಇನ್ನೂ ಹೆಚ್ಚೆಚ್ಚು ರೀತಿಯ ಕೆಲಸಗಳನ್ನು ಮಾಡ್ತಾರೆ. ನಂದೀಶ್ ಅವರು ಯಾಕೆ ನಾವು ಇವತ್ತು ಈ ಒಂದು ಸಂಚಿಕೆಯನ್ನು ಅವರಿಂದ ಶುರು ಮಾಡ್ತಿದ್ದೀವಿ ಅಂದರೆ ಒಂದು ಕಾರಣ ಇದೆ. ನಂದೀಶ್ ಅವರು ಈ ಒಂದು ಪ್ರಾಂತದಲ್ಲಿ ಹೆಸರು ಡಾಕ್ಟರ್ ಫಾರ್ ಇಸ್ ಕಂಪ್ಯಾಷನೇಟ್. ಅವರು ಏನು ಹೇಳ್ತಾರೆ, ಕರುಣಾಮಯಿ. ಇಟ್ಸ್ ನಾಟ್ ಎ ಪ್ರಾಪರ್ ವರ್ಡ್ ಇನ್ ಕನ್ನಡ. ಕಂಪ್ಯಾಷನೇಟ್ ಅನ್ನೋದು ಸರಿ ಹೋಗುತ್ತೆ. ಅದಕ್ಕೆ ಹೆಸರುವಾಸಿ. ಆ್ಯಂಡ್ ಎನಿಬಡಿ ಹೂ ನೋಸ್ ಡಾಕ್ಟರ್ ನಂದೀಶ್ ಇನ್ ದಟ್ ರೀಜನ್ ಆರ್ ಅದರ್ವೈಸ್ ಆಲ್ಸೋ ನೋಸ್ ಹಿಮ್. ಹಿಸ್ ಡೆಡಿಕೇಶನ್ ಟು ಪೇಷಂಟ್ಸ್, ವಿಚ್ ಇಸ್ ಸಮರ್ಪಣೆ ಅಂತ ಹೇಳ್ಬೋದು ಕನ್ನಡದಲ್ಲಿ. ಇಟ್ಸ್ ಎ ಗೋಲ್ಡ್ ಸ್ಟ್ಯಾಂಡರ್ಡ್. he sets a standard for care for patients, and then their ability to and then to get better in what ailment they have. ಎಲ್ಲದಕ್ಕೂ ತುಂಬ ಹೆಸರುವಾಸಿದಂಥ ಒಬ್ಬ ಡಾಕ್ಟರ್. ಅದರಿಂದ ನಾವು ಈ ಒಂದು ಸಂಚಿಕೆಯನ್ನು ಅವರಿಂದ ಶುರು ಮಾಡೋಣ ಒಂದು ಹಂಬಲ ಇಟ್ಕೊಂಡು ಬಂದಿದ್ದೀವಿ. ಕಾರ್ಯಕ್ರಮ ಶುರು ಮಾಡೋಕ್ಕೆ ಮುಂಚೆ ಇನ್ನೊಂದು ಹೇಳ್ತೀನಿ ಸ್ನೇಹಿತರೆ. ಇಲ್ಲಿ ಕೆಲವರಿಗೆ ನಮ್ಮಲ್ಲಿ ಹಲವಾರು ಜನ ನಾವೊಂದಿಲ್ಲಿ ಜಾಯಿನ್ ಮಾಡಿರೋರಿಗೆ ಡಾಕ್ಟರ್ ಚೆನ್ನಾಗಿ ಗೊತ್ತು, ನನ್ನ ಒಡನಾಟ ಇದೆ, ಇದರ್ ಟೇಕನ್ ಎ ಮೆಡಿಕಲ್ ಹೆಲ್ಪ್ ಆರ್ ಈವನ್ ಇನ್ ಅ ಕಮ್ಯುನಿಟಿ ಸೀನ್, ನನಗೆ ಚೆನ್ನಾಗಿ ಗೊತ್ತು, ಅವರು ನನಗೆ ಭಾಳ ಬಲ್ಲೆ, ನನಗೆ ಭಾಳ ಇಷ್ಟ ಅಂತ ಹೇಳ್ಬೋದು. ಆದರೆ ಐ ಕ್ಯಾನ್ ಕಡಾಖಂಡಿತವಾಗಿ ಹೇಳಬಲ್ಲೆ, ದೇರ್ ಆರ್ ಫೇಸಸ್ ಆಫ್ ನಂದೀಶ್ ಯು ಮೇ ನಾಟ್ ನೋ ವಿಚ್ ಯು ಶುಡ್ ನೋ. ಸೊ in that regard, I'm really happy to welcome him today, and talk about areas you probably don't know. I can guarantee you don't know this, and some people may know it. To a very close friend of his may know it, but there's something for all of us to understand in a very health ಒಂದು ಹೆಲ್ತ್ ವಿಷಯ ಅಲ್ಲ, ಹೆಲ್ತ್ ಕೇರ್ ಬಗ್ಗೆ, ರೂರಲ್ ಹೆಲ್ತ್ ಕೇರ್ ಬಗ್ಗೆ ಒಂದು ಮಹತ್ತರವಾದ ಒಂದು ವಿಷಯವನ್ನು ನಾವು ತಿಳ್ಕೊಳ್ತೀವಿ. ಅದೇ ರೀತಿ ಒಬ್ಬ ಸಕ್ಸಸ್ಫುಲ್ ಡಾಕ್ಟರ್ ಕಮ್ಯುನಿಟಿ ಅಲ್ಲದೆ ಇನ್ನು ಯಾವ ಥರದ ಕೆಲಸಗಳನ್ನ ಮಾಡ್ತಾರೆ, ಯಾಕೆ ಮಾಡ್ತಾರೆ, ಅವರ ಹಂಬಲ ಏನು, ಅವರ ಬ್ಯಾಕ್ಗ್ರೌಂಡ್ ಏನು, ಎಲ್ಲದನ್ನು ತಿಳ್ಕೊಂಡಂತೆ ಬನ್ನಿ. ಸೊ ಲೇಡೀಸ್ ಅಂಡ್ ಜೆಂಟಲ್ಮೆನ್ ಆ್ಯಂಡ್ ಬಾಯ್ಸ್ ಅಂಡ್ ಗರ್ಲ್ಸ್, ಪ್ಲೀಸ್ ಹೆಲ್ಪ್ ಮಿ ವೆಲ್ಕಮ್ ಡಾಕ್ಟರ್ ನಂದೀಶ್. ನಂದೀಶ್ ಅವರೇ, ನಮಸ್ಕಾರ.
ನಮಸ್ಕಾರ ಸುರೇಶ್ ಅವರೇ ಮತ್ತು ಬೆಂಗಳೂರು ವಾಯ್ಸ್ ತಂಡದವರಿಗೆ, and to all the viewers of Bengaluru Voice, my namaskaras.
Thank you so much. Very very happy to have you here, Dr. Nandeesh. ನಾನು ನಂದೀಶ್ ಅಂತ ಕರಿತಾ ಇರ್ತೀನಿ. ದಯವಿಟ್ಟು ಪ್ಲೀಸ್ ಅಲೋ ಮಿ ಟು ಡೂ ದ್ಯಾಟ್. ನಮ್ಮ ಕೇಳುಗರಿಗೆ ಇಲ್ಲಿಂದ ಶುರು ಮಾಡೋಣ. I will, now friends, I will take this program in 3 segments. So let me start the first segment. Let's try to understand the man behind the successful doctor we all know, or many of you are known, or many of you will get to know now. So, ನಂದೀಶ್, ನೀವು ಬಹಳ ವರ್ಷಗಳಿಂದ ಸಕ್ಸಸ್ಫುಲ್ ಆಗಿ ಪ್ರಾಕ್ಟೀಸ್ ಮಾಡ್ಕೊಂಡು ಬಂದಿದ್ದೀರಾ. ಇನ್ನು ಹಲವಾರು ಹೆಲ್ತ್ ಕೇರ್ ವಿಚಾರದಲ್ಲಿ ಹಲವಾರು ಥಿಂಗ್ಸ್ಗಳನ್ನ ನೀವು ಮಾಡ್ತೀರಾ. ಸೊ ವಾಕ್ ಅಸ್ ಥ್ರೂ, ಲೆಟ್ಸ್ ಟೇಕ್ ಯು ಬ್ಯಾಕ್ ಟು ಮೆಮೊರಿ ಲೈನ್. ವಾಕ್ ಅಸ್ ಥ್ರೂ your life, your journey, ನಿಮ್ಮ ಚೈಲ್ಡ್ಹುಡ್ ಇಂದ ಯಾವಾಗಿಂದ ನಿಮಗೆ ಇದು ಮಾಡಬೇಕು ಅನಿಸ್ತು, ಯಾಕೆ ಮಾಡಬೇಕು, ಯಾಕೆ ಈ ಫೀಲ್ಡ್ ಬರಬೇಕು ಅನಿಸ್ತು, ಬಂದಾಗ ಏನಿಸ್ತು, ಇವಾಗ ಏನು ಮಾಡ್ತಾ ಇದ್ದೀರಾ? ಸೊ ಜಸ್ಟ್ ವಾಕ್ ಅಸ್ ಥ್ರೂ ದ ಎಂಟೈರ್ ಲೈಫ್ ಜರ್ನಿ ಆಫ್ ಯುವರ್ಸ್.
ನಾನು ಹುಟ್ಟಿದ್ದು ಶಿವಮೊಗ್ಗದಲ್ಲೇ, and my parents are from Shimoga and Bhadravati area, and ಬೆಳೆದಿದ್ದೆಲ್ಲ ಬೆಂಗಳೂರಲ್ಲೇ, and did 12th standard ಅಲ್ಲೇ ಮಾಡಬೇಕಾದಾಗ the one thing I really did not like was math, and what was my easy way to get away from math was to figure out something else where I'm not going to use too much of math. So what started as an innocent idea has been a very fulfilling journey. So I decided to choose anything but engineering. Decided to go to medicine. At time you either were an engineer or was doing medicine, or you were doing nothing at all. So that is where it started. And MBBS Mysore alle JSS Medical College ಮಾಡಿದೆ. Then after that did MS in general surgery ದಾವಣಗೆರೆ ಅಂತ. I did ಅದಾದ್ಮೇಲೆ then went to Bombay for about a year, came back and decided to immigrate to the US, just like quite a few of my friends. And once I started coming here, then I decided that even though I did surgery, I wasn't wanting to do the long journey of redoing surgery. What a lot of people don't understand is, ಇಂಡಿಯಾದಲ್ಲಿ ನೀವು MS ಮಾಡಿರ್ಬೋದು, ಅಥವಾ MD ಇಂಟರ್ನಲ್ ಮೆಡಿಸಿನ್ ಮಾಡಿರ್ಬೋದು, ಅಥವಾ ಇನ್ನೇನಾದ್ರು ಪೋಸ್ಟ್ ಗ್ರಾಜುಯೇಷನ್ ಮಾಡಿರ್ಬೋದು, but that is not considered here as an asset. You have to redo your post graduation here. And knowing me doing surgery for 4.5 years, then going and doing super specialty, and that would have been a long journey. So I decided to do family medicine, which was the best decision I ever did. And I did 1 ವರ್ಷ ಟೆಕ್ಸಸ್ ಅಲ್ಲಿ ಮಾಡಿ, ಅದಾದ್ಮೇಲೆ then I decided to move to California. Did it in Modesto, Central Valley alle, and ಅದಾದ್ಮೇಲೆ then joined Family Healthcare Medical Group ಅಂತ ಪ್ರೈವೇಟ್ ಪ್ರಾಕ್ಟೀಸ್ ಅಲ್ಲೇ ಸೇರ್ಕೊಂಡು and I'm still there, 22 years and counting, still there. Then did a few other things, then started a non-profit organization doing healthcare in rural California to bring healthcare to people who don't get adequate healthcare, and thought I could do things a little bit better. And we have a good team uh, and delivering care. Uh, I moved to the Bay Area about 8 years ago, 8 or 9 years ago, and got to know a lot of you, met a lot of ನಮ್ಮ ಕನ್ನಡ ಫ್ರೆಂಡ್ಸ್. ಹಂಗಾಗಿ ಐ I've been able to do my little part in serving the community and also the underserved community too. So this is my journey.
ಥ್ಯಾಂಕ್ ಯು ನಂದೀಶ್. ಸೊ ನಂದೀಶ್, ನಾವು ಎಲ್ಲರೂ ಭಾಳಷ್ಟು ಜನ ಡಾಕ್ಟರ್ಸ್ನ ಇನ್ ಆರ್ ಲೈಫ್ ವುಡ್ ಹ್ಯಾವ್ ಟಚ್ಡ್, ರೈಟ್? ಸೊ ಪ್ರತಿಯೊಬ್ಬರಿಗೂ ಒಂದು ಎಕ್ಸ್ಪೀರಿಯನ್ಸ್ ಇರುತ್ತೆ. ಆ, ನಿಮ್ಮ ಸೇವಾ ಮನೋಭಾವ, ನಾನು ಒಂದು ದಯವಿಟ್ಟು ಎನ್ಕ್ಯಾಪ್ಸುಲೇಟ್ ಆಲ್ ದಟ್ ಗ್ರೇಟ್ ಥಿಂಗ್ಸ್ ಯು ಡೂ ಈಸ್ impeccable, right? And that's just not my word, and it's the people's word. ಈ ಒಂದು ಸೇವಾ ಮನೋಭಾವ, ಡಾಕ್ಟರ್ ವಿತ್ ಸೇವಾ ಮನೋಭಾವ ಈಕ್ವಲೆಂಟ್ ಟು ಎ ಸರ್ವಿಸ್ ವಿಚ್ ಇಸ್ ಗಾಡ್ ಸೆಂಡ್ ಅಂತ ಹೇಳ್ಬೋದು. ಅತಿ ವೈದ್ಯೋ ನಾರಾಯಣಯೋ ಹರಿ ಅಂತಾರೆ, ಆ ರೀತಿ, ರೈಟ್? ಸೊ ಇಸ್ ದಟ್ ಇಟ್ಸ್ ಎ ಗಾಡ್ ಸೆಂಡ್. ನಿಮ್ಮ ಅಪ್ಬ್ರಿಂಗಿಂಗ್, had it influence on ನಿಮ್ಮ ವೈಯಕ್ತಿಕ, ಇಟ್ಸ್ ಅ ಪರ್ಸನಾಲಿಟಿ, ಐ ಕ್ಯಾನ್ ಅಂಡರ್ಸ್ಟ್ಯಾಂಡ್. ಸೊ ಒಂದು ಪರ್ಸನಾಲಿಟಿ ಇರುತ್ತೆ, ಈ ರೀತಿ ಮಾಡಬೇಕು ಅಂತ, ರೈಟ್? ಸೊ ನಾನು ಐ ವಾಂಟ್ ಟು ಡ್ವೆಲ್ ಆನ್ ಇಟ್ ಎ ಲಿಲ್ ಬಿಟ್ ಮೋರ್ ಆಸ್ ಐ ಗೋ ಅಲಾಂಗ್. ಬಟ್ was your upbringing and background, how did that influence you to be this kind of compassionate, caring for patient and seva manobhava? So how did that influence you?
Uh, my parents had a big influence on me, and also I used to go to ನಮ್ಮ ಹಳ್ಳಿಗಳಿಗೆ ಹೋದಾಗ used to see my ನಮ್ಮ ಮಾವ ಅವರು, he is a ಆಯುರ್ವೇದ ಡಾಕ್ಟರ್. ಆಮೇಲೆ ನಮ್ಮ ಚಿಕ್ಕಪ್ಪನವರು ಆಯುರ್ವೇದ ಡಾಕ್ಟರ್. So I could see some of the care that they were giving in the rural communities. ಸಂತೆಗಳಿಗೆ ಹೋಗೋದು, ಅಲ್ಲಿ ಕ್ಲಿನಿಕ್ ಮಾಡೋದು, delivering care in the poorest of the poorest neighborhoods, and still enjoying doing what they're doing and coming back. That had some amount of influence. And of course, my father has been the biggest influence in my life. Do anything you do it well, and don't look back. Nothing is impossible. So that is some of those attitudes that he instilled, and also the idea of service, especially to the underserved or the people who don't get healthcare, both there and what I realized is even in this richest country, it is still the same thing. It is just a different country with the same problems, with different complexities. Just trying to figure it out and try to deliver the best that we could possibly do.
ಸ್ನೇಹಿತರೆ, ಯು ಮಸ್ಟ್ ಬಿ ವಂಡ್ರಿಂಗ್ ವಾಟ್ ಲೈನ್ ಆಮ್ ಐ ಗೋಯಿಂಗ್ ಅಂತ. ಸೊ ನಿಮಗೆ ನಾನು ಈ 3 ಹಂತಗಳಲ್ಲಿ ಕಾರ್ಯಕ್ರಮ ಮಾಡ್ತೀನಿ. ಮೊದಲನೇದಾಗಿ ನಾನು ನಿಮಗೆ ಡಾಕ್ಟರ್ ನಂದೀಶ್ ವೀರಪ್ಪನ ಪರಿಚಯ ಮಾಡಿಕೊಡ್ಬೇಕು, ಅವರ ಕೆಲಸಗಳ ಬಗ್ಗೆ ಹೇಳಬೇಕು. ಎರಡನೇದಾಗಿ ರೂರಲ್ ಹೆಲ್ತ್ ಬಗ್ಗೆ ಅವರು ಮಾಡೋಕ್ಕಂಥ ಒಂದು ಅತಿಶಯೋಕ್ತಿ, selfless great service. I want to talk about it. I want to spend good time talking to you about it. It will be a good information for you. ಇವಾಗ ತಾನೇ ಹೇಳಿದ್ರು, ರಿಚೆಸ್ಟ್ ನೇಷನ್ ಇರ್ಬೋದು, ಪ್ರಾಬ್ಲಮ್ಸ್ ಆರ್ ದ ಸೇಮ್ ಅಂತ. ಸ್ವಲ್ಪ ಡ್ವೆಲ್ ಇನ್ ಮಾಡೋಣ. ಅದಾದ ನಂತರ doctors go in life irutte, and they also do other than healthcare as well. So I want to dwell a bit on that, right? So ಈ ಮೂರು ಹಂತಗಳಲ್ಲಿ ನಾನು ನಿಮ್ಮ ಜೊತೆ ಈ ಒಂದು ಸಂಭಾಷಣೆ ಮಾಡ್ತೀನಿ. ಮೊದಲನೇ ಸಂಭಾಷಣೆ ಮುಂದುವರ್ಸೋಣ. ಆಮ್, uh, Nadish, you spoke, you practice in Central Valley. You also spoke about rural health. ನಮ್ಮ ಲಿಸನರ್ಸ್ಗೆ ಸೆಂಟ್ರಲ್ ವ್ಯಾಲಿ, ರೂರಲ್ ಹೆಲ್ತ್, ನಿಮ್ಮ ಪ್ರಾಕ್ಟೀಸು, ಸುದೀರ್ಘ ಪ್ರಯಾಣ, 27 ವರ್ಷಗಳ ಪ್ರಯಾಣ, ಅಲ್ಲಿ ಆ ಒಂದು ಜರ್ನಿ, ಆ ಒಂದು ವಿಷಯಗಳ ಬಗ್ಗೆ, ಅಥವಾ ಆಲ್ಸೋ ಪ್ಲಸ್ ಎರಡನೇ ಕ್ವಶನ್, ಎನಿ ಮೆಮೊರಬಲ್ ಎಕ್ಸ್ಪೀರಿಯನ್ಸಸ್ ವೈಲ್ ಸರ್ವಿಂಗ್ ದ ಕಮ್ಯುನಿಟಿ ದೇರ್, ಇಫ್ ಯು ಕ್ಯಾನ್ ಡಿಲಿನಿಯೇಟ್ ದಿಸ್ ಫಾರ್ ಅವರ್ ಆಡಿಯನ್ಸ್.
ಶಾರ್ಟ್ಲಿ ನಂದು ಓದೋದೆಲ್ಲ ಮುಗಿದಾದ್ಮೇಲೆ ಐ ವಾಸ್ ರೆಡಿ ಟು ಪ್ರಾಕ್ಟಿಸ್. ಸೊ ಐ ಗಾಟ್ ಆಫರ್ಡ್ very good position in one of the best practices in the Central Valley, Modesto, which was very hard for me to refuse when I just graduated, and started doing private practice. Along with that, the teacher in me was also wanting to do some teaching. So I did teaching at a residency program, Modesto Dalle, affiliated with UC Davis. So I was a community assistant professor of the residency program, and did that teaching for at least about 8 to 9 years. Astrology and practice covered a busy eye, so I could not continue doing it. And there were other people who had stepped into the role. Did private practice. Along with that, I was always doing other things. I ended up doing hospice for about 8 years. Hospice andre people who have a life expectancy of 6 years, 6 months or less, who are in the process of dying or actively dying. So avrna to deliver care for them. Yeah. So that was something that I did along with my private practice. Throughout my journey in life, I've done not just only private practice. I've always tried to find something else to do other than that. So in that way, I'm not a typical family doctor. I always try to do something more than just see your average patient from 8 to 5. So in that, I've worn many hats. And, Central Valley was where I initially started. I'll start madadaga. It used to remind me of some of the rural areas in India too, if you tend to look at it. Nimige enadru ಹೆಲ್ತ್ ಕೇರ್ ಏನಾದ್ರು ಬೇಕು ಅಂದ್ರೆ ಕರ್ನಾಟಕದಲ್ಲೇ ಎಲ್ಲರನ್ನು ಬೆಂಗಳೂರಿಗೆ ಬರೋರು, ಅಥವಾ ಮೈಸೂರಿಗೆ, ಅಥವಾ ಸಮ್ ಅದರ್ ಬಿಗ್ ಸೆಂಟರ್ಸ್. ಬಟ್ ಹೂ ವಾಸ್ ಡೆಲಿವರಿಂಗ್ ದ ಕೇರ್ ಇನ್ ಸಮ್ ಆಫ್ ದ ವಿಲೇಜಸ್? ನೋಬಡಿ. ಅವರು ಬಸ್ ಹತ್ಬಿಟ್ಟು ದೊಡ್ಡ ದೊಡ್ಡ ಸಿಟಿಗಳಿಗೆ ಬಂದು ದೇ ಯೂಸ್ ಟು ಗೆಟ್ ದ ಕೇರ್, ಪೇ ಥ್ರೂ ದೇರ್ ನೋಸಸ್, and then go back. That is exactly the same thing that is happening here also, even as of today. So the idea is, how can you change that trajectory in whatever way, shape or form to bring more care, more accessible care to the Central Valley, is where I have been, and find innovative solutions. So that has been my journey as far as the medicine is concerned.
ಸ್ನೇಹಿತರೆ, ನಾವು ಮಾತಾಡ್ತಾ ಇದ್ದೀವಿ ಡಾಕ್ಟರ್ ನಂದೀಶ್ ಜೊತೆ, ಡಾಕ್ಟರ್ ನಂದೀಶ್ ವೀರಪ್ಪ ಅವರ ಜೊತೆ. ನಮ್ಮ 2024 ಹೆಲ್ತ್ ಸೀರೀಸ್, ವಿ ಆರ್ ಲೈವ್ ಆನ್ ಯೂಟ್ಯೂಬ್ ಅಂಡ್ ಫೇಸ್ಬುಕ್. ನಿಮಗೆ ಡಾಕ್ಟರ್ ನಂದೀಶ್ ಅವರಿಗೆ ಪ್ರಶಂಸೆ ತೋರಿಸ್ಬೇಕು ಅಥವಾ ಏನಾದ್ರು ಪ್ರಶ್ನೆಗಳಿದೆ ಅಂದರೆ ನೀವು ನಮಗೆ ಚಾಟ್ ಮೂಲಕ ನಮಗೆ ತಿಳಿಸಿ. ನಾವು ವಿ ವಿಲ್ ಬಿ ಏಬಲ್ ಟು ಆಸ್ಕ್ ಯು ದ್ಯಾಟ್. ನಂದೀಶ್ ಸುಧೀರ್ ಗುಂಡನ ಹೇಳ್ತಾರೆ, ಗುಡ್ ಟು ನೋ ಮೋರ್ ಅಬೌಟ್ ನಂದೀಶ್, ಪ್ರೋಗ್ರಾಮ್ ಚೆನ್ನಾಗಿ ಬರ್ತಿದೆ ಅಂತ ಒಂದು ಒಂದು ಮೆಸೇಜ್ ಹಾಕಿದರೆ. ಥ್ಯಾಂಕ್ ಯು, ಥ್ಯಾಂಕ್ ಯು ಸುಧೀರ್. Stay on and we'll get you will know more. But that prompts me, Sudhir ಅವರ ಪ್ರಶ್ನೆ or the comment prompts me to switch to something, right? And I'll come back to this topic about getting to know you a little bit more, after this segment. So ನೀವು ಫ್ಯಾಮಿಲಿ ಹೆಲ್ತ್ ಕೇರ್ನಲ್ಲಿ ಫ್ಯಾಮಿಲಿ ಫಿಸಿಷಿಯನ್, but you're also the CMO of Community Health Center of America, which is a federally qualified health center. Nanu, I want to ask you the journey of you starting the Community Health Center of America, and also what does this federally qualified health center mean? ಆಮೇಲೆ ಯಾವ ಥರದ ಕೇರ್ ಜನರಿಗೆ ಬೇಕಾಗತ್ತೆ, ಯಾವ್ಯಾವ ರೀತಿ ನಡೆಯುತ್ತೆ, ಸ್ವಲ್ಪ ವಿವರವಾಗಿ detail. Let's start from that. What is this Community Health Center of America? What prompted you to start there? What did you do, and what are you going to do?
So I was doing private practice, just like everybody else. So one of the things that I was noticing was private practice andre who are my patients? Patients like you, patients like me, patients like a lot of my friends and the audience. So ನಮಗೆ ಪ್ರೈವೇಟ್ ಹೆಲ್ತ್ ಇನ್ಶೂರೆನ್ಸ್ ಇರುತ್ತೆ. ಇಟ್ ಕುಡ್ ಬಿ ಕೈಸರ್, ಇಟ್ ಕುಡ್ ಬಿ ಎಟ್ನಾ, ಸಿಗ್ನಾ, ಯಾವುದಾದ್ರೂ ಪ್ರೈವೇಟ್ ಹೆಲ್ತ್ ಇನ್ಶೂರೆನ್ಸ್ ಇರುತ್ತೆ. ಬಟ್ there is also a population that has Medicare, ಅಂದ್ರೆ ನಮಗೆ ಸೀನಿಯರ್ ಇರೋವಂಥದ್ದು, ಅಥವಾ Medi-Cal in California or Medicaid in the rest of the country. These are people who are on government subsidized insurance for economically deprived communities. And these people tend to have a very hard time getting access to care. ಈಗ ಪ್ರೈವೇಟ್ ಪ್ರಾಕ್ಟೀಸ್ ಅಲ್ಲ, ನಾನೇನಾದರೂ ಮೆಡಿಕ್ಯಾಲ್ ಪೇಷಂಟ್ ಏನಾದರೂ ನೋಡಬೇಕು ಅಂದರೆ, the amount, at least when I was initially practicing, was about $16 for every patient I saw, which they have now increased it to about 32. And with $32, I cannot pay my overhead, I cannot pay my staff, I cannot pay myself. So wanting to do the care is impossible to the people you want to take care of. So doctors do not step up to the plate to deliver the care. So what the government did was they wanted to encourage care to the underserved community. So they started something called as the federally qualified health center. Illi they incentivize you to deliver care by giving you a higher reimbursement, and so that you can take care of the people and deliver quality care, irrespective of a patient's ability to pay based on their economic conditions. So it is a good program, and you will be surprised that these federally qualified health centers are throughout the country. There are in California 174 federally qualified health centers idave, and there are what is called as patient centers, almost close to about 10,000. So what happens is, ಈಗ federally qualified health center ಅಂದ್ರೆ you have to see anybody who comes through the door. That is one criteria. Second criteria is you have to be able to deliver the care. Even if you go there, they should be able to do it. But at the same time, somebody who does not have money, who is below the federal poverty level, they should still deliver the care, and they can deliver the care free of cost. They are mandated to do that. That is why they tend to get a higher reimbursement. What we were seeing was that because I was in the rural community, because I knew what was going on, I was seeing that they were not doing the job the way they were supposed to be doing, and not really able to cover quite a bit of the community. So ಇವರೆಲ್ಲರನ್ನು ಮಾಡ್ತಾ ಇದ್ದಾರೆ. These are not doctors. These are people who have decided that they wanted to get into the game and try to do it. Um, so, started another project and started a non-profit organization. ಅದಕ್ಕೆ Community Health Centers of America ಅಂತ ಕರೆದು we started in a small clinic in Gustine, California. Nobody would have even heard about it. We started there. Then after that, we opened another one in Chowchilla, another one in Mariposa. ಯಾರಾದರೂ ಎಸಮಿಟಿ ವ್ಯಾಲಿಗೆ ಎಸಮಿಟಿಗೆ ಹೋಗ್ಬೇಕಾದಾಗ ಸೌತ್ ಎಂಟ್ರೆನ್ಸ್ ಇಂದ ಹೋಗ್ಬೇಕಾದಾಗ ಮ್ಯಾರಿಪೋಸ್ ಅಂತ ಒಂದು ಊರು ಬರುತ್ತೆ, ಅಲ್ಲಿ ಇನ್ನೊಂದು ಸ್ಟಾರ್ಟ್ ಮಾಡಿದ್ವಿ. ಸೊ ವಿ started that in about 2018, and now we are at about 11 clinics, and we are looking to acquire another 3 and deliver care in Monterey County all the way to Bakersfield in Sacramento County. This is how we have grown to at least ನಮ್ಮಲ್ಲಿ ಕೈಯಲ್ಲಾಗಿದ್ದ ಅಳಿಲ್ ಸೇವೆಗಳು ನಾವು ಮಾಡ್ಬೋದು ಅಂದ್ಬಿಟ್ಟು, ದಟ್ ಈಸ್ ದ ಮಿಷನ್ ಟು ಡೆಲಿವರ್ ಕೇರ್ that is more comprehensive, much better, and at the same time bring more resources to the underserved community. One of the things that we have done, I'll just give you an example. Gustine anta ಊರಲ್ಲೇ ಅಂದ್ರೆ, think about your typical village, wherever in India that you could think about. Instead of the people in that small town called as Gustine to get healthcare for specialists, ಅವರು ಎಲ್ಲಿಗೆ ಹೋಗಬೇಕು? ಕೆಲವು ಸತಿ Modesto, about 40 miles, or they will have to come to San Francisco. So one of the collaboration that we did was with UCSF, University of California, San Francisco, where we started a neurology clinic. ತಿಂಗಳಿಗೆ 2 ಬಾರಿ ನ್ಯೂರಾಲಜಿಸ್ಟ್ಗಳು ಸ್ಯಾನ್ ಫ್ರಾನ್ಸಿಸ್ಕೋ, ಯೂನಿವರ್ಸಿಟಿ ಆಫ್ ಕ್ಯಾಲಿಫೋರ್ನಿಯಾ ಸ್ಯಾನ್ ಫ್ರಾನ್ಸಿಸ್ಕೋ ಎಂದು ಬಂದು, they tend to deliver care there. This is a collaboration that was 2 years in the making, and we have been running it successfully, and soon we are in talks to introduce other specialties such as endocrinology and rheumatology, because there is a need. Instead of the people in the rural community who do not have transportation, who do not have the means to go to all the centers to get the care, we are trying to see how we can do to deliver the care there. So these are some of the things that we can do as long as there is community support. And we have partners. We have built partnerships with some non-profit organizations, community members, stakeholders, to bring solutions to problems that has been existing for the last 100+ years, and nobody has made a dent. And hopefully we can bring in some solutions, innovative solutions to these problems.
Nandesh, hats off to you. This is so heartening to know. A rich nation like America, needs this kind of care. ಸ್ನೇಹಿತರೆ, ಫಾರ್ ಯಾರ್ if you're outside of California, ನಾವೇನು ಹೇಳ್ತೀವಿ ಅಂದರೆ, ಈ ನಾರ್ದರ್ನ್ ಕ್ಯಾಲಿಫೋರ್ನಿಯಾ, ಸಿಲಿಕನ್ ವ್ಯಾಲಿ ಅಂತ ಏನು ಹೇಳ್ತೀವಿ, ಒನ್ ಆಫ್ ದ ರಿಚೆಸ್ಟ್ ಪ್ಲೇಸ್ ಇನ್ ದ US. ಇಲ್ಲಿಂದ 40 ಮೈಲಿ ದೂರ, 80 ಮೈಲಿ ದೂರ, 100 ಮೈಲಿ ದೂರ, ಅಲ್ಲಿಂದ ಎಲ್ಲ ಹಳ್ಳಿಗಳು. ದಟ್ ಈಸ್ ವಾಟ್ Nandeesh is talking about. Modesto is a village in the a rural place in the Central Valley. Alinda Gustin, Mariposa. There's another 40 miles, a real rural. Also agricultural place, agricultural place, other sources of income. Is what he's talking about. Just to level set that. ನಿಜವಾಗ್ಲೂ ನನಗೆ ಇಷ್ಟೊಂದು ಥರದ ಕೇರು ಮಾಡುವ ಅಗತ್ಯ ಇದೆ ಅಂತ ನನಗೆ ಗೊತ್ತಿರಲಿಲ್ಲ. ಏನಂದರೆ ದಿಸ್ ಕಂಟ್ರಿ ವರ್ಕ್ಸ್ ಡಿಫರೆಂಟ್ಲಿ ದೆನ್ ಅದರ್, and I thought it was, I always thought that they all get the care, but I was a novice, so I didn't know that. ನಾನು ಇನ್ನೊಂದು ಅನ್ಕೊಳ್ತೀನಿ, ಎಕ್ಸ್ಪ್ಲೈನ್ ಮಾಡ್ತಿರುವಾಗ, ಯು ಗಿವ್ ದಮ್ ಸಿಂಪಲ್ ಕೇರ್, ದ ರೊಟೀನ್ ಕೇರ್ ಕೊಡ್ತೀರಾ ಅಂತ ಅನ್ಕೊಳ್ತಿದ್ದೆ. ಬಟ್ ಯು ಟಾಕಿಂಗ್ ಅಬೌಟ್ ಸ್ಪೆಷಾಲಿಟಿ ಕೇರ್. ಯು ಸ್ಪೋಕ್ ಅಬೌಟ್ ನ್ಯೂರಾಲಜಿ, in all the specialization. That means that, and that's what is needed for them when you get to their doors. ಇದು ನನಗೆ ಇನ್ನೊಂದು ಸ್ವಲ್ಪ, ಈ ಪುವರ್ ಅಂದರೆ ಏನು, ಅವ್ರು ಏನು ಮಾಡ್ತಾರೆ, ಯಾವ ಒಂದು ಎಕನಾಮಿಕ್ ಸ್ಟೇಟಸಲ್ಲಿ ಇರ್ತಾರೆ, ಯಾವ ಥರದ ಕೇರ್ಸ್ ಮಾಡ್ತೀರಾ, ಒಂದಷ್ಟು ಎಕ್ಸ್ಪೀರಿಯನ್ಸಸ್ ಏನು, ಯಾವ ರೀತಿ ಪೇಷಂಟ್ಸ್ಗಳೆಲ್ಲ ಬರ್ತಾರೆ, ಅವರಿಗೆ ಅಗತ್ಯಗಳು ಏನಿರುತ್ತೆ, ಒಂದಷ್ಟು ಹೇಳಿದ್ರೆ ಹೆಂಗೆ ಪೂರೈಸ್ತೀರಾ ನೀವು. ಇಟ್ ಕ್ಯಾನ್ ಬಿ ಇನ್ ಆಲ್ ದಿಸ್ ಸೆಂಟರ್ಸ್, ದೇರ್ ಕುಡ್ ಬಿ ವೆರಿ ಮೆನಿ ಆಫ್ ದೆಮ್. ಇದನ್ನೆಲ್ಲ ವಿವರ ತಿಳ್ಕೊಳ್ಳೋಕ್ಕೆ ಬಹಳ ಕುತೂಹಲ. But we will take a short break. We'll take a 2-minute break just to thank our sponsors. ನಮ್ಮ ಬೆಂಗಳೂರು ವಾಯ್ಸ್ನ ಜೀವಾಳ ಅಂದರೆ ನಮ್ಮ ಸ್ಪಾನ್ಸರ್. ಅವರ ಸಹಾಯದಿಂದ ನಾವು ಈ ಥರ ಕಾರ್ಯಕ್ರಮ ಮಾಡಕ್ಕೆ ಆಗ್ತಿರೋದು. ಒಂದು ನಮ್ಮ ಸ್ಪಾನ್ಸರ್ ಬಗ್ಗೆ ಜಸ್ಟ್ ಎ 2-minute ವಿಡಿಯೋ, ಒಂದು ವಿಡಿಯೋ ನೋಡ್ಕೊಂಡು ಬರೋಣ, ದೆನ್ ವಿಲ್ ಕಂಟಿನ್ಯೂ. ಸ್ಟೇ ಆನ್.
Finlo Tax, the leading tax consultant in the Bay Area. ಪ್ರಸನ್ನ ಕುಮಾರ್ ಅವರು ಯಾರಿಗೆ ತಾನೇ ಗೊತ್ತಿಲ್ಲ, ಬೇ ಏರಿಯಾದ ಪ್ರೊಫೆಷನಲ್ ಟ್ಯಾಕ್ಸ್ ಕನ್ಸಲ್ಟೆಂಟ್. ಟ್ಯಾಕ್ಸ್ ಫೈಲಿಂಗ್, ಟ್ಯಾಕ್ಸ್ ಪ್ರಿಪರೇಷನ್, ಅಕೌಂಟಿಂಗ್, ಪ್ಲಾನಿಂಗ್, ಬುಕ್ ಕೀಪಿಂಗ್ ಸರ್ವಿಸಸ್ ಫಾರ್ ಇಂಡಿವಿಜುವಲ್ ಅಥವಾ ಸ್ಮಾಲ್ ಬಿಸ್ನೆಸ್. ಯಾವುದೇ ಥರದ ಟ್ಯಾಕ್ಸ್ ಕನ್ಸಲ್ಟೆಂಟ್ ಪ್ರಶ್ನೆಗೆ ಯು ಕ್ಯಾನ್ ರೀಚ್ ಪ್ರಸನ್ನ ಕುಮಾರ್ at 408-222-0259. ಮೈಸೂರು ಶ್ರೀರಂಗ ಫಾರ್ ಆಲ್ ಯೋರ್ ಆಟೋಮೊಬೈಲ್ ಸರ್ವಿಸಸ್. 20 ವರ್ಷಗಳಿಂದಲೂ ಬೇರೆಯಲ್ಲಿ ಅತ್ಯುತ್ತಮ ಸರ್ವಿಸಸ್ನ ಕೊಡ್ತಿದ್ದಾರೆ. ನಿಮ್ಮ ವಾಹನದ ಆರೈಕೆಗೆ ಒನ್ ಆ್ಯಂಡ್ ಓನ್ಲಿ ಪರ್ಸನ್ ಶ್ರೀ ಆಟೋ ಸರ್ವಿಸಸ್. ಶ್ರೀ ಆಟೋ ಸರ್ವಿಸಸ್ ಫ್ರೀಮಾಂಟ್ನಲ್ಲಿದೆ. ಅವರ ಫೋನ್ ನಂಬರ್ 510-996-8404. ಇನ್ನೊಮ್ಮೆ 510-996-8404. ಅಮೇರಿಕಾದಲ್ಲಿ ಮನೆ ತಗೊಳ್ಬೇಕು ಅನ್ನೋದು ನಿಮ್ಮೆಲ್ಲರ ಡ್ರೀಮ್ ಅಲ್ವಾ? ಈ ಡ್ರೀಮ್ನ ಸಹಕಾರ ಮಾಡಕ್ಕೆ ಬಂದಿದ್ದಾರೆ ನಮ್ಮ ಗಿರೀಶ್ ಬ್ಯಾಂಗ್ಳೂರ್. ಎಸ್, ರಿಯಲ್ ಎಸ್ಟೇಟಲ್ಲಿ ಟಾಪ್ ನಾಚ್ ಸರ್ವಿಸ್ ಕೊಡ್ತಿರೋ ಗಿರೀಶ್ ಅವರು ನಮ್ಮ ಕನ್ನಡಿಗರೇ. ಕನ್ನಡದವರೇ ಆದ ಗಿರೀಶ್ ಜೊತೆ ರಿಯಲ್ ಎಸ್ಟೇಟ್ ಬಗ್ಗೆ ತಿಳ್ಕೊಳ್ಳೋಕ್ಕೆ ಬಹಳ ಚೆನ್ನಾಗಿರುತ್ತೆ. ಹಿ ಈಸ್ ಸೋ ನಾಲೆಜಬಲ್. ನನ್ನ ಪರ್ಸ್ನಲ್ ಎಕ್ಸ್ಪೀರಿಯನ್ಸ್, ರಿಯಲ್ ಎಸ್ಟೇಟ್ ಇನ್ ಆ್ಯಂಡ್ ಔಟ್ ಚೆನ್ನಾಗಿ ತಿಳ್ಕೊಂಡಿದ್ದಾರೆ. ಎಲ್ಲಿ ನಿಮ್ಮ ಡ್ರೀಮ್ ಹೌಸ್ ತಗೋಬೋದು, ಎಲ್ಲಿ ಇನ್ವೆಸ್ಟ್ ಮಾಡ್ಬೋದು, ಬೀಚ್ ಯೋರ್ ಫಸ್ಟ್ ಹೋಮ್ ಆರ್ ಯೋರ್ ಸೆಕೆಂಡ್ ಆರ್ ಮೆನಿ ಮೋರ್. ಫಾರ್ ರೀಚ್ ಔಟ್ ಗಿರೀಶ್ at 408-420-0646 ಅಥವಾ gbangalore@interroad.com. ಫೈನಾನ್ಷಿಯಲ್ ಫ್ರೀಡಮ್ ಯಾರಿಗೆ ತಾನೇ ಬೇಕಿಲ್ಲ? ಬಟ್ ಫೈನಾನ್ಷಿಯಲ್ಸ್ ಅಂದ ತಕ್ಷಣ ತಲೆನೋವು ಜಾಸ್ತಿ ಅಲ್ವಾ? ಡೋಂಟ್ ವರಿ, ಫಾರ್ ಆಲ್ ಯುವರ್ ಫೈನಾನ್ಷಿಯಲ್ ಕ್ವೆಶ್ಚನ್ಸ್, ಎಸ್, ಇನ್ವೆಸ್ಟ್ಮೆಂಟ್ ಇರ್ಬೋದು, 401k ರೋಲ್ ಓವರ್ ಇರ್ಬೋದು, ರಿಟೈರ್ಮೆಂಟ್ ಪ್ಲ್ಯಾನ್, ಡೆಟ್ ಮ್ಯಾನೇಜ್ಮೆಂಟ್, ಎಜುಕೇಷನಲ್ ಸೇವಿಂಗ್ಸ್, ಫಿನಾನ್ಷಿಯಲ್ ಪ್ಲಾನಿಂಗ್, ಪ್ರೊಟೆಕ್ಷನ್, ಲೈಫ್, ಆಟೋ, ಹೋಮ್, ರೀಫೈನಾನ್ಸ್ ಆರ್ ಮಾರ್ಗೇಜ್ ಲೋನ್ಸ್, ಯಾವುದೇ ಇರ್ಬೋದು. ನಿಮ್ಮ ಎಲ್ಲ ಲೀಗಲ್ ಸಮಸ್ಯೆಗೆ ಪರಿಹಾರ ಬೇಕು ಅಂದರೆ ಎಸ್, ರೀಚ್ ಔಟ್ ಟು ಅನಿಲ್ ಹಾಲಪ್ಪ. ಹೌದು, ಅನಿಲ್ ಹಾಲಪ್ಪ ಅವರ ಮೊಬೈಲ್ ನಂಬರ್ 209-380-9858 ಅಥವಾ halappa@premierica.com. ನಮ್ಮ ಎಲ್ಲ ಸ್ಪಾನ್ಸರ್ಸ್ಗಳಿಗೂ ನಮ್ಮ ಬೆಂಗಳೂರು ವಾಯ್ಸ್ ಕಡೆಯಿಂದ ಒಂದು ಬಿಗ್ ಥ್ಯಾಂಕ್ ಯು.
ಸ್ನೇಹಿತರೆ, ವೆಲ್ಕಮ್ ಬ್ಯಾಕ್. ನಾವು ಮಾತಾಡ್ತಾ ಇದ್ದೀವಿ ಬೆಂಗಳೂರು ವಾಯ್ಸ್ನ 415ನೇ ಸಂಚಿಕೆ ಹೆಲ್ತ್ ಸೀರೀಸ್. ಈ ಒಂದು ಕಂತಿನ ಮೊದಲನೇ ಭಾಗ. ನಾವು ಮಾತಾಡ್ತಾ ಇದ್ದೀವಿ ಡಾಕ್ಟರ್ ನಂದೀಶ್ ವೀರಪ್ಪ ಅವರ ಜೊತೆ. ಆ್ಯಂಡ್ ವಿ ಆರ್ ಆನ್ ಫೇಸ್ಬುಕ್ ಆ್ಯಂಡ್ ಯೂಟ್ಯೂಬ್. ವಿ ಆರ್ ಗೋಯಿಂಗ್ ಲೈವ್, ವಿ ಆರ್ ಆನ್ ಇನ್ಸ್ಟಾಗ್ರಾಮ್ ಟು. ನಿಮ್ಮಲ್ಲಿನ ಪ್ರಶಂಸೆ ತೋರಿಸ್ಬೇಕು, ಅದರ ಪ್ರಶ್ನೆಗಳು ಕೇಳಬೇಕು ಅಂದರೆ ಖಂಡಿತ ನಮ್ಮ ಚಾಟ್ ಮೂಲಕ ಅಲ್ಲಿ ನೀವು ಹಾಕಿದ್ರೆ ನಾವು ಅದನ್ನು ಕೇಳಬಹುದು. So let's continue. Nandeesh, I want to go a little faster in this segment. But no, to the question I asked before we took a break. So, you know, what kind of, I was just asking about what kind of patients you see, what kind of care they need. Tell us some of those experiences of treating them and how do you manage all these things. So, just a little bit more for our audience. ರೂರಲ್ ಅಂದ್ರೆ ಏನು, ಎಂತ ಎಕನಾಮಿಕ್ ಸ್ಟೇಟಸ್ ಇರುತ್ತೆ, ಯಾವ ರೀತಿ ಪೇಷಂಟ್ ಏನು ಕೇರ್ ಬೇಕು?
Rural andre, I go back and forth comparing some of the things that is there here and back home in India, just for perspective purposes. Rural is just like any other place, even in India. Halliyalle. Here, it can be farmers, migrant workers, undocumented workers, just people who have a lot of healthcare issues. What you need to understand is that people in the Bay Area, people like you, me, uh, tend to go to the doctor uh, only when there is some kind of an issue. And I don't think most of the audience members have even gone to a doctor more than once or twice a year. Maybe a small subset of people tend to go because health issues kadame ಇದೆ ನಮ್ಮ Bay Area community. But at the same time, the lower the socioeconomic status, the more the health issues. Think about your farmers, your laborers, your field workers, your contractors, your landscape people. Uh, People who tend to come and do your lawns do not stay in the Bay Area. They come from far off places. They come from the Central Valley. They come from other places where they can afford homes, where they raise families. So these people tend to have a lot of health issues. It can be diabetes, COPD, asthma, COPD, blood pressure problems, strokes, uh, congestive heart failure. You just name a problem, including cancer, all of this. It tends to be more in the lower socioeconomic status people. These are the people who have a lot of health issues, who can least afford and who cannot get the care. How are you going to solve this problem? You have to figure out solutions where somebody is going to take care of these people to try to fix some of the problems, try to get them specialty care. Hospitalization ಮಾಡಬೇಕು ಅಂದ್ರೆ hospitalization ಮಾಡಬೇಕು. They need so many things other than just medicine. They need access to a doctor, they need access to child care, they need access to transportation, they need access to food, they need access to clothing, they need access to all kinds of supportive things that needs to be done, because ಅವ್ರು ಮಾಡೋ ದುಡ್ಡಲ್ಲೇ ಅವರಿಗೆ ಹೊಟ್ಟೆಗೆ ಊಟಕ್ಕೋಸ್ಕರ ಉಪಯೋಗಿಸ್ಬೇಕು. Otherwise they have to spend money on medicines or go to the doctors. For somebody to travel from rural Gustine to come to San Francisco, it is going to cost them almost close to $100. I don't know about you. I don't know how many people can really afford $100 for them to go from one place to another to get healthcare. So what do? They forgo healthcare. If you and me are going to be thinking twice about traveling because it is going to cost $100 to put gas in your car, think about these people. It becomes hard for them to get care. So what will they do? They will let the health issues get worse till they end up in complications, and they're going to end up in the hospital whether they like it or not. So it is not just only about healthcare, it is about trying to give the whole person care to these people. And somebody has to make a difference in these people's lives. I don't profess that I have a solution to everything, but ನನ್ನ ಕೈಲಾದಷ್ಟು ನನಗೆ ತೋಚಿದಷ್ಟು ನಾನು ಎಷ್ಟು ಮಾಡಬಲ್ಲೆ, ಐ ವಾಂಟ್ ಟು ಡೂ ಇಟ್. And that is what I signed up for in the first place. Money will come. ನನ್ನ ಪ್ರೈವೇಟ್ ಪ್ರಾಕ್ಟೀಸ್ ಅಲ್ಲಿ ನನಗೆ ಚೆನ್ನಾಗೆ ದುಡ್ಡು ಬರುತ್ತೆ, ಬಟ್ ಅಟ್ ದ ಸೇಮ್ ಟೈಮ್ ಗಾಟ್ ಟು ಗಿವ್ ಬ್ಯಾಕ್ ಟು ದ ಕಮ್ಯುನಿಟಿ ಟು. And how best can I give, knowing what I know? I cannot sit still and let these things happen, mainly because it is not my fight to fight. I have to do something. So that is where we started with this, and trying to forge partnership, trying to do things uh, in a way that I know best. So that is where I am.
Yeah. So ಶ್ಲಾಘನೀಯ, ತುಂಬಾ ಶ್ಲಾಘನೀಯ. It's profound and very, very appreciable. Very noteworthy. Nandesh, thank you so much for taking our viewers through this, our listeners through this. It's fantastic. I mean, this is not a common knowledge. A lot of people tend to think that this problem may not exist, or they don't even pay attention to this problem could potentially exist. ನೀವು ಅದು ಪ್ರಾಬ್ಲಮ್ನ ಸಾಲ್ವ್ ಮಾಡಲಿಕ್ಕೆ you started a non-profit organization. You got in now more than 10 clinics, and you're going to grow that while doing all this 8 to 5 job of at family healthcare. I know you're a very sought after doctor. It takes time to get an appointment with you, and despite that you do this, and really, really, from all of us side, from all the listeners, hats off to you again. We truly, truly appreciate your sense of care. I mean, to the needy, ಬೇರೆ ಬೇಕಾದವ್ರಿಗೆ ಈ ಸೇವಾ ಮನೋಭಾವ ಇದು ತುಂಬಾ ಶ್ಲಾಘನೀಯ, right? ಒಂದು ಪ್ರಶ್ನೆ ಬರುತ್ತೆ, shifting gears, and I got to shift gear. So you got a 8 to 5 every day. You also have good travel time. I understand, to the clinic. You do that. You do this activity as well. You also do lots of community work. We'll come to that later. How do you keep this mental balance? This is, what kind of stress do you carry? What kind of mental balance? I mean, you're listening to all patients' problem day in, day out, trying to solve that. Plus, you got a family to run, right? So, henti maklo. So, what kind of stress you go through, and how do you keep that balance?
Work is work. The challenges of work is something that I enjoy, and I like a challenge. I like to try and troubleshoot things, and see what I can do differently than what has already been done, and trying to talk with multiple people. A lot of people want to help. They don't know how. They don't know what to do. Sometimes having a conversation with a lot of stakeholders tends to take time, and building relationships, trying to solve problems takes time. As far as me, I'm lucky. I have a wonderful wife, Padmashri, and I have 2 kids. My wife takes care of everything in the house. I do not do anything. I am totally useless at home. As far as things that I do outside, without her support, without her standing by me, it wouldn't have been possible at all. So I can, if you think that I am doing all of this, this is the easiest part. What she does is the hardest part. So that takes a lot of stress out of me. Because for me, family is important. For me, my family is very, very, very important, and she keeps the balance. As far as work is concerned, it is fun to solve problems. Patients will ನೋಡೋದು ಅವ್ರದ್ದು ಹೆಲ್ತ್ ಕೇರ್ issues, trying to take care of the health problems that people tend to have. After some time, it becomes the most easiest part. what is very hard is the things that are associated with that, that becomes very frustrating and time consuming. ಈಗ say suppose somebody is having a health problem. ನೀವು ಇಂಡಿಯಾದಲ್ಲಿ ಹೋದ್ರೆ, say suppose you have some kind of a cardiac issue, which happened to one of my family members recently too. You have find something in the problem, you can call the cardiologist, get an appointment the same day or the very next day, get a procedure the same day or the very next day, and get it taken care of within about 3 days or 4 days. This has been my experience in India. Yes, there may be some challenges, but you can get those things done there. The same patient, if you tend to tell, if that person has, say suppose somebody comes to my clinic saying that, I have some chest discomfort, yeah, nothing major as such, but this has been going on for a long period of time, comes in, okay, I will try to get an EKG done in the office. If I have to get a cardiology consultation and do some testing, it takes weeks. I have to get insurance authorization. I have to get that confirmed by the insurance, then do a referral to the cardiologist's office. By the time you end up going and seeing the cardiologist for a non-critical chest pain, takes about 3 weeks, 4 weeks. ಹೋಗಿ ಅವ್ರ ಹತ್ರ ಕನ್ಸಲ್ಟೇಷನ್ ಮಾಡಿ ಅವ್ರು ಇನ್ನೊಂದಿಷ್ಟು ಟೆಸ್ಟ್ ಮಾಡಬೇಕು, ಅದು ಇನ್ನೊಂದು ವಾರ 2 ವಾರ ಆಗುತ್ತೆ. ಸೊ ಬೈ ದ ಟೈಮ್ ಯು ಆರ್ ಡನ್, it takes about a month to month and a half. That is the most frustrating part. Not taking care of the patient, seeing the patient doing the things that needs to be done is not the most frustrating part. So for all the people who tend to think that the care is excellent and taking care of these issues is done, it sure is done, but there is so much of delayed care, there is so much of unnecessary issues and regulations that you cannot solve those problems unless it comes from the top. You can do your part and maybe a little more, but those are the frustrating parts more than anything. But these are challenges. Try to figure it out and try to see how you can deliver the care.
Yeah. So thank you so much. Right. Again, ಪ್ರತಿಯೊಂದು ಪ್ರಶ್ನೆಗೂ ನಿಮ್ಮ answer, it is. I want to comment on it, but I think I'll leave it to listeners because I'm sure they are observing that as well. But it's fantastic. I'm going to shift gear again.
Sure.
Nandesh, you're known for your knowledge on multiple fields of medical and your ability to guide people and to what they should do, in various specialty care, ailments, anything like that. You're also known to do this for community. For example, ನಮ್ಮ ಸ್ನೇಹಿತರಾದಂಥ ಗಿರೀಶ್ ಅವರು ಅಸ್ವಸ್ಥರಾದಾಗ you went and helped, and to the extent family was waiting for you to come and guide, hey, what should the right next step I should take in this situation ಅಂತ. You also come and any visiting parents, if they need some care, you personally get them to home and give it a care. I know there is a lot to do with doctors, their practice, their liabilities, but you're doing all beyond that and beyond that. So whenever in the community you live in, whenever somebody needs help, Dr. Nandeesh is the person to call, or somebody who knows Dr. Nandeesh, or that person who they want to get to and get to Nandeesh. ಸೊ ಇದ್ರ ಬಗ್ಗೆ ಒಂದಷ್ಟು ನಿಮಗೆ ಒಂದು ಇದು ನಿಮ್ಮ ಮನೋಭಾವ ಏನಿಲ್ಲಿ, ನೀವು ಯಾವ ರೀತಿ ಮಾಡ್ತೀರಾ, ಯಾವ ರೀತಿ ಎಕ್ಸ್ಪೀರಿಯನ್ಸಸ್ಸು, it's really amazing to see this. I mean, those who experienced it can relate to it 1,000 times more better. But however, some comment from you on that.
All I can say is it is my way of giving back to the community. ನಮ್ಮ ಕಮ್ಯುನಿಟಿನವರಿಗೂ ನಾನು accessible ಇರಬೇಕು. Everybody has problems. The other things you can get it taken care of. Sometimes, when healthcare issues adaga, it becomes a big challenge. Things that I noticed was that you have your parents come from India, and if somebody falls sick, the problem is on the parent side, they don't want to get care mainly because they think that it is the most expensive thing that is going to happen. It is going to put a lot of burden on my kids. And on the kids side, it is going to be, oh my God, there is such a huge burden that is going to be uh, to go see a doctor, to go get the testing done, to get the treatment. It does not have to be that way. So I do some part of it. Nam Kannada ಸಂಘದಿಂದ ಬರೋ ಜನಗಳು and or affiliate people who tend to come. I do not have a clinic in the Bay Area. As you know, I wear multiple hats. So what is my easiest way? I tell them, come home, let me have a look at you, see what is going on, and I do the treatment and I send home. What I get out of it is, one, ನಾನು ಸೇವೆ ಮಾಡ್ತಾ ಇದ್ದೆ, and plus I get to meet so many interesting people, so many nice people. When I tend to see somebody's father or mother, I tend to think about them similar to my father and mother. All I need is just their blessing. I make money. It is not at all about the money. It is all about, I get to meet people, I get to talk to them. Just the other day, ನಮ್ಮ ಸ್ಯಾಂಡ್ರಮೋನಿಂದ ಯಾರೋ ಬಂದಿದ್ರು. It was a simple problem, but the poor man was suffering for more than 2 weeks. Cold agi, bronchitis agi, he couldn't breathe properly, coughing, and he was suffering for 2 weeks for unnecessary reason. So they found me through somebody they knew. Bandru, treated. Still, follow up is like he's doing a lot better within 2 days. But I get to find out our Bengaluru Noro. He is an architect, and he has a life story of his own. And I get to meet interesting people. That is the fun part about for me to give the care to people. But one of the things I want to bring to the audience that they may or may not know is, ಈಗ ಊರಿಂದ ಬರ್ತಾರಲ್ಲ ಕೆಲವರು ವಿಸಿಟರ್ ಇನ್ಶೂರೆನ್ಸ್ ತಗೊಂಡ್ ಬರ್ತಾರೆ. ಬಟ್ ದ ಪ್ರಾಬ್ಲಮ್ ಇಸ್, ನಾನು ಆಸ್ ಅ ಡಾಕ್ಟರ್ ಐ ಕ್ಯಾನ್ ಟೆಲ್ ಯು ದಟ್ ವಿಸಿಟರ್ಸ್ ಇನ್ಶೂರೆನ್ಸ್ ಬಹಳ ಕಡಿಮೆ ಜನ ತಗೊಳ್ತಾರೆ. ಯಾಕಂದ್ರೆ ಇಟ್ ಈಸ್ a headache to navigate that process. I would rather do free care than take that health insurance for outpatient. But you still want to get health insurance. ಅಕಸ್ಮಾತ್ ಬಹಳ ಸೀರಿಯಸ್ ಆಗಿ ಹಾಸ್ಪಿಟಲ್ಗೆ ಹೋಗೋ ಪರಿಸ್ಥಿತಿ ಬಂತು ಅಂದ್ರೆ ಅವಾಗ ಅದು ಉಪಯೋಗಕ್ಕೆ ಬರುತ್ತೆ. The other thing that I want to tell you, I had told you about federally qualified health centers, right? Federally qualified health centers, like I said, in and around San Jose, 34 idave federally qualified health centers. There are multiple ones in Pleasanton, Alameda County alli ಸುಮಾರು ಇದೆ, Contra Costa County alli ಸುಮಾರು ಇದೆ. ನೀವು ಎಲ್ಲೆಲ್ಲಿ ಇರ್ತಿರೋ ಅಲ್ಲಿ ಫೆಡರಲಿ ಕ್ವಾಲಿಫೈಡ್ ಹೆಲ್ತ್ ಸೆಂಟರ್ಸ್ಗಳು ಎಲ್ಲಿದ್ದಾವೆ ಅನ್ನೋದು ಅದನ್ನ ಗುರುತಿಡ್ಕೊಂಡ್ರೆ, you can get the care. You can make an appointment and go there and get the care. And they cannot refuse the care, and they should not refuse the care. The other thing is, whether you have the ability to pay, your parents have the ability to pay or not pay, is immaterial. Federally qualified health center, there is something called as a sliding fee discount scale. In the sense, if you are at or below the federal poverty level, which in your parents' case is going to be the case because they are not earning anything out here. So they will be in that particular category. The cost of getting a consultation should be maybe $0 to $2 to $5 to $10 at the most. And if they need x-rays, they do have contracts with certain radiology places where they can still use the sliding fee discount model to give you discounted rates. The other thing is, the third thing that people tend to face is blood work ಮಾಡಿಸ್ಕೋ. We had similar kind of situation with another family in San Ramon, same issue. Ulta Labs anta ಒಂದು lab ಇದೆ. You can actually go on their website and you can order the labs that you want ordered, which will be done at any Quest Diagnostic Labs in your same area for almost about 60-70% discount rate. You don't need a doctor's prescription. You can do it yourself if you know what you are ordering. If there is some kind of, you can always talk with somebody back home and ask what labs, and it can be done. So there is workarounds for some of these problems. You just have to know it and educate yourself about it, and or talk with somebody who knows about it.
ಎಕ್ಸಲೆಂಟ್. ಆನಂದ್ ಸತ್ಯನಾರಾಯಣ ಹೇಳ್ತಾ ಇದ್ದಾರೆ, ಥ್ಯಾಂಕ್ ಯು ಫಾರ್ ಯರ್ ಸರ್ವಿಸ್ ಟು ದಿ ಕಮ್ಯುನಿಟಿ. ಡಾಕ್ಟರ್ ನಂದೀಶ್ ಅವರೇ, ಗಾಡ್ ಬ್ಲೆಸ್ ಯು ಅಂತ. ಸುಧೀರ್ ಗುಂಡಣ್ಣ ಅವರು 3 ಹೇಳ್ತಾ ಇದ್ದಾರೆ, ಐ ನೋ ಹೌ ಇಂಜಿನಿಯರ್ ಲೈಫ್ ಈಸ್ ಬಟ್ ನೆವರ್ ಥಾಟ್ ಹೌ ಎ ಡಾಕ್ಟರ್ ಡೇ ವಿಲ್ ಬಿ. ನಂದೀಶ್, ಹೌ ವಿಲ್ ಯು ಬಿ ನಂದೀಶ್, ಹೌ ವಿಲ್ ಬಿ ಯಾ ಬ್ಯುಸಿ ಡೇ ಲುಕ್ ಲೈಕ್ ಅಂತ ಒಂದು ಹೇಳ್ತಾ ಇದ್ದಾರೆ. ಥ್ಯಾಂಕ್ ಯು ಸುಧೀರ್, ಥ್ಯಾಂಕ್ ಯು ಆನಂದ್. ಬರ್ತಿಲ್ಲ ಹೇಗೆ ಪ್ರಶ್ನೆಗಳು. ಸೊ ಐ ಜಸ್ಟ್ ವಾಂಟ್ ಮೂವ್ ಫಾರ್ವರ್ಡ್. ನೋಡಿ, ಮಾಡ್ತಾ ಒಂದು ಗಂಟೆ ಹಾಗೆ ಹೋಯ್ತು. ಇನ್ನು ಎಷ್ಟೋ ಪ್ರಶ್ನೆಗಳಿತ್ತು. ಬಟ್ ಐ ವಾಂಟ್ ಶಿಫ್ಟ್ ಗೇರ್. ಒಂದು, Nandesh, we have the privilege and advantage of knowing many people from many fields, and many doctors, many community workers, as well as professionals, things like that. I can only tell you, you are a very rare breed, very, very rare breed. We're lucky to have you amongst us, who has this seva manavava. It is really, really, really admirable, as to what you do. Please continue to do, and anything we can help, any of this thing our listeners can help, we are happy to. We may not have the skill, but at least have the interest to help somebody. I think that's what we should do. So I will go to one more segment, right, with all those things. That is what I told you about. You don't know Dr. Nandeesh, right? Now you know him, right? So ಈ ಒಂದು ಮೆಡಿಕಲ್ ಫೀಲ್ಡ್ ಬಿಟ್ಟು ಯು ಆರ್ ಆಲ್ಸೋ ಆಂಟ್ರಪ್ರನರ್, right? I think that's the mark of a bright people. They just bright achievers have many things to do. ನಾವು ಅನ್ಕೋತೀವಿ ಒಂದು ಕೆಲಸ ಬೆಳಗಿನ ಸಾಯಂಕಾಲ ಕೆಲಸ ಮಾಡಿಬಿಟ್ಟು ಇನ್ನೇನೋ ಒಂದು ಕೆಲಸ ಇದ್ರೇನೆ ನಾವು ಯಾವ ಅಂತೀವಿ. So you do so many other things, right? So I know you did dialysis center. I know you run a booming, venture. ನಮ್ಮ ಕೇಳುಗರಿಗೆ, the reason I'm asking you that is that, look, you can always find time to do what's you're passionate about, and how, apart from your profession, however busy it is outside of that. Ivelru ಬಗ್ಗೆ ನಿಮ್ಮ dialysis center, what you did, and how it worked out, and then your booming, venture.
I always liked real estate. It is something that has always caught my attention. Downturn iddaga, when the economy had gone south somewhere in the 2010-2011 time alle. So we just bought a plot of land in Central Valley, of course, series anbuttu alli we bought a piece of land, and then we decided that we wanted to build a dialysis center because that was something that we thought was a good business to do. So that was our very, very first venture that we did. Me and few of my friends joined together, and we built a dialysis center. Took us about 2 years. Construction ella ನನ್ನ ಫ್ರೆಂಡ್ ಸಿವಿಲ್ ಇಂಜಿನಿಯರ್ ಆಗಿದ್ದಾರೆ. ಸೊ ಹಂಗಾಗಿ we managed to do it. And within, even before the doors were opened, we sold it to a big company, and we made a few bucks. Madi, then we decided to invest in multifamily real estate, apartment complexes. We always thought that apartment complexes would be a good place to be. So that is when we also started another company called as Boomi and Bhutto. Started with a few friends, bought an apartment complex in Modesto. 750,000 ಎಲ್ಲರೂ 50,000 ಹಾಕ್ಬಿಟ್ಟು ತಗೊಂಡು bought it, and as leverage that one, buy another one, get in more investors to come in, shareholders. And 2012 is, I think, when we started that one. 2012, 2013, and now it is about 10, 11 years later. That group of investors, which was originally, I think, about 7 people, now it is about 60 people, is what I understand. What was $750,000 apartment complex that we had bought. We bought multiple other things, and it's worth today on the market about $44 million. And we've given good shareholder returns for people who have invested in that. It's a very open, transparent process, and people who are on, our investors, are also on the executive committee, on the board, and it has been a nice, successful journey for that particular company that we have. And we do other things also, but mainly real estate is what we try to do. Have a very, very, very good team who tend to do that, and I'm a part of it.
Excellent. So while nothing to do with his profession, that's another phase of Nandeesh. I understand. Model invest ಮಾಡಿದವರು 50K in the beginning they invested. It's almost about $1 million now. So ನಾನು ಯಾತಕ್ಕೆ ತೊಗೊಂಡು ಬಂದೆ ಅಂದರೆ ನಿಮಗೊಂದು ಮಾಹಿತಿ ದೊರಕಲಿ, ನಿಮಗೆ ಏನಾರ ಇಂಟ್ರೆಸ್ಟ್ ಇದ್ದರೆ ಅದನ್ನು ಉಪಯೋಗಿಸ್ಕೊಳ್ಳಿ ಅಂತ. ಒಂದು ಎರಡನೇದು, ಇದೊಂದು ಸಾಧ್ಯತೆಗಳು, ಏನು ಸಾಧ್ಯತೆಗಳು ಇರುತ್ತೆ ಅನ್ನುವ ಒಂದು ಮಾಹಿತಿ ನಿಮಗೆ ಸಿಗಲಿ ಅಂತ ನಾನು ನಮ್ಮ ಬೆಂಗಳೂರು ವಾಯ್ಸ್ ತಂಡದ ವಿಡಿಯೋ ಆನ್ ಮಾಡ್ಕೋಬೇಕು ಅಂತ ಕೇಳ್ತೀನಿ, ರವಿ ಮತ್ತು ಗೋಪಿ. ಸೊ Nandeesh, it's really great to know you as Nandeesh, right? So get to know you completely, So ಈ ಒಂದು ಕಾರ್ಯಕ್ರಮದ ಉದ್ದೇಶನೇ ಅದು. ನಿಮ್ಮಂಥ we are achievers all over. You are also a distinguished achiever in this space. ಭದ್ರಾವತಿಯಿಂದ ಬಂದು, ಶಿವಮೊಗ್ಗ, ಭದ್ರಾವತಿ, ಬೆಂಗಳೂರಿಂದ ಬಂದು ಈ ಒಂದು ರಿಚ್ ನೇಷನ್ನಲ್ಲಿ ರೂರಲ್ ಪೀಪಲ್ಗೆ ಒಂದು ಕೇರ್ ಅಂತ ಕೊಡಿಸುವಂಥ ಒಂದು ಶ್ಲಾಘನೀಯವಾದ ಒಂದು ಕೆಲಸವನ್ನು ಮಾಡ್ತಿದ್ದೀರಾ. ಎಲ್ಲಿಂದ ಎಲ್ಲಿಗೆ ಪ್ರಯಾಣ ಆ್ಯಂಡ್ ಯಾವ ರೀತಿಯ ಸೇವೆ, right? So this is really, really noteworthy, and we're very, very proud, that we know you and you're among us. And thank you for what you're doing, and continue to do what you're doing. And like I said, whether we or any of our listeners can help, do let us know. But more than anything else, it's a good information, and what a fantastic start to our health series. Alba, Ravi and Gopi. So thanks for being on our show. Appreciate it. Nano, Ravi, I would, can I request you to say a few words?
Yeah, it's really privilege, and we are blessed to know Dr. Nandeesh here, being part of our community, Tri-Valley Kannada Sangha. He is, what he said about himself is absolutely, 1/10 of what he does for the community. Now, ಇಲ್ಲಿ ಎನಿಬಡಿ ಪೇರೆಂಟ್ಸ್ ಇರಲಿ, ಏನಾದರೂ ಹೆಲ್ತ್ ಪ್ರಾಬ್ಲಮ್ ಅಂದರೆ 1-800 ಹೆಲ್ಪ್ ಇಸ್ ನಂದೀಶ್. ಆ್ಯಂಡ್ ಹೀ ಈಸ್ ಸೋ ಓಪನ್. ಹೀ ತಗೊಂಬನ್ನಿ, ಕರ್ಕೊಂಬನ್ನಿ ಸರ್. He doesn't even think. And there was a case where night 1:32 he was there helping, when it was needed, medical help needed. He was there at 1:32 in the night. So that kind of he's a man with big heart. He is really a man with big heart. So thanks Nandeesh for being there for us at all times, and not just medical side, even on the, Nandish's wife Padmashri avaru, she is a food chair for Tri Valley Kannada Sangha. I mean, she is, so both husband and wife are so dedicated to the community service, leave alone their professional. They have been doing so much in the professional side, but even on the other side, they have been, they have been an asset to Tri Valley Kannada Sangha and the, community. It's not just Kannada. Anybody idre avaru is a one-stop shop for any help. So thanks Nandeesh. We are really, really blessed. One, for you to be here, and also as a friend, we are really blessed, Nandeesh, and we wish you the best. And anytime we are there, we are all a family. Thanks for all that you do, Nandeesh.
Thank you so much, Ravi, Suresh, Gopi avare, and all the other team members of Bengaluru Voice. And thank you to everybody who's tuned in to listen to this episode. I am truly honored and humbled. And if there is something that I could do from my part, please reach out to me. I'm more than happy to help. Thank you so much.
So, and we have a long tail of our listeners too, who actually listen to it more intently, after the show. So I'm sure they'll appreciate it. Now I'm going to break a protocol today and then ask Gopi to add a few words before we conclude.
ನಂದೀಶ್ ಬಗ್ಗೆ ಎಲ್ಲ ಗೊತ್ತಿತ್ತು, ಫ್ಯಾಮಿಲಿ ಫ್ರೆಂಡ್ ಅಂತ. ಅವ್ರದ್ದು ಸರ್ವಿಸ್ ಕಮ್ಯುನಿಟಿಗೆ ನಾನು ಒಂದು ಇನ್ಸ್ಟೆನ್ಸ್ ಇದೆ, ಅವ್ರ ರವಿ ಹೈಲೈಟ್ ಮಾಡಿದ್ರು. ನಾಟ್ ಓನ್ಲಿ ಕನ್ನಡ, ಎನಿ ಇಂಡಿಯನ್ ಆರ್ ಎನಿಬಡಿ ಆಸ್ ಫಾರ್ ದ ಹೆಲ್ಪ್, ನಂದೀಶ್ ಇಸ್ ದ ಪರ್ಸನ್ ಟು ಗೋ. ನಾನು ನಂದೀಶಿಗೆ ಒಂದ್ಸಲ ಐ ಸ್ಟಿಲ್ ರಿಮೆಂಬರ್, ನನ್ನ ತಮಿಳ್ ಫ್ಯಾಮಿಲಿ, ದೇವರ್ ಇನ್ ಎ ವೆರಿ ಬ್ಯಾಡ್ ಶೇಪ್. ನಂದೀಶ್ ಈ ಥರ ಪೇರೆಂಟ್ಸ್ ಏನೋ ಪ್ರಾಬ್ಲಮ್ ಆಗಿದೆ ನಂದೀಶ್, ದೇ ಆರ್ ಇನ್ ಎ ಪ್ಯಾನಿಕ್ ಮೋಡ್, ಪ್ಲೀಸ್ ಹೆಲ್ಪ್. ಒಂದು ಕಾಲ್ ಅಷ್ಟೇ, ಅವರು ಜಸ್ಟ್ ಏನೋ ಗೋಪಿ ಮನೆಗೆ ಬರಕ್ಕೆ ಹೇಳಿ. ಸೊ ಮನೆಗೆ ಬಂದವರಿಗೆ, ಆ ಮೆಂಟಲಿ ಡಿಸ್ಟರ್ಬ್ ಆಗಿದ್ದವ್ರಿಗೆ, ದ ವೇ ನಂದೀಶ್ ಕನ್ವಿನ್ಸ್ ದೆಮ್, ಅವ್ರಿಗೆ ಟ್ರೀಟ್ಮೆಂಟ್ ಇಲ್ದಲ್ಲೇ ಆಲ್ಮೋಸ್ಟ್ 50% ಹುಷಾರ್ ಮಾಡಿ ಕಳ್ಸಿದ್ರು. ನಾನು ಏನು ಕೇಳ್ತಾ ಇದ್ದೀನಿ ಅಂದ್ರೆ, ನಂದೀಶ್ ಫಸ್ಟ್ ಆಫ್ ಆಲ್ ರೀಚ್ ಮಾಡೋದೇ ಕಷ್ಟ ಇಂಥ ಟೈಮಲ್ಲಿ. The way he kind of convinced the parents, the way he treated parents, ಅದು I still remember. ಅವ್ರು ಈಗ ಟ್ಯೂನ್ ಮಾಡಿದ್ದಾರೆ, ಇಂಡಿಯಾದಿಂದ ಕೇಳಿಸ್ಕೊತಾ ಇದ್ದಾರೆ. ಇವಾಗ ನಾನು ಕಳ್ಸಿದ್ದೆ ನೋಡಿಯಪ್ಪ ನಿಮ್ಮ ಡಾಕ್ಟರ್ ಇಸ್ ಆನ್ ಅವರ್ ರೇಡಿಯೋ ಶೋ ಅಂತ. ಸೊ ನಂದೀಶ್ ಇದೇ ತರ ಕಮ್ಯುನಿಟಿ ಮಾಡ್ತಾ ಇರಿ, ದೇವ್ರು ನಿಮಗೆ ಸ್ಟ್ರೆಂತ್ ಕೊಡ್ಲಿ ಅಷ್ಟೇ ನಾವು ಕೇಳ್ಕೊಳ್ಳೋದು. ನಿಮಗೆ ಗುಡ್ ಲಕ್ ನಂದೀಶ್.
ನಂದೀಶ್, ಥ್ಯಾಂಕ್ ಯು ಸೊ ಮಚ್ ಅಗೈನ್ ನಮ್ಮ ವೇದಿಕೆಗೆ ಬಂದು ನಮ್ಮ ಜೊತೆ ಇಷ್ಟೊತ್ತು ಕಾಲ ಕಳೆದಿದ್ದಕ್ಕೆ. ಸಾರಿ, ನಾವು ಸ್ವಲ್ಪ ಟೈಮ್ ಮೀರಿದ್ವಿ, ಬಟ್ ಇಟ್ ಇಸ್ ಆಲ್ ಫಾರ್ ದ ರೈಟ್ ಕಾಸ್. ಥ್ಯಾಂಕ್ ಯು ಸೋ ಮಚ್ ಫಾರ್ ಬೀಯಿಂಗ್ ಹಿಯರ್. ಸ್ನೇಹಿತರೆ, ನೀವೇನು ಟ್ಯೂನ್ ಇನ್ ಮಾಡೋದಕ್ಕೆ ಥ್ಯಾಂಕ್ಸ್, ಅಥವಾ ಅದು ಆ ಪ್ರೋಗ್ರಾಮ್ನ ಕೇಳಿಸ್ಕೊಳ್ತಿತ್ತ ಅಂತ ಅಂದ್ಕೊಳ್ತೀನಿ. ಅದಕ್ಕೂ ನಿಮಗೆ ಧನ್ಯವಾದಗಳು. ಇದೇ ರೀತಿ ಮುಂದಿನ ವಾರ ಇದೇ ಸಮಯದಲ್ಲಿ ಇದೇ ಸ್ಥಳದಲ್ಲಿ ಮತ್ತೊಬ್ಬ ಡಾಕ್ಟರ್ ಒಂದಿಗೆ ನಾವು ನಮ್ಮ ಸಂಭಾಷಣೆ, ಹೆಲ್ತ್ ಸೀರೀಸ್ ಸಂಭಾಷಣೆ ಮುಂದುವರ್ಸೋಣ. ಅಲ್ಲಿ ತನಕ ನಿಮ್ಮ ಮನಸ್ಸು ನಿಮ್ಮ ಹೃದಯ ರಾಜಿಸಿರಲಿ. ಬೆಂಗಳೂರು ವಾಯ್ಸ್, ಲಿಸನ್ ಟು ಯುವರ್ ಹಾರ್ಟ್.
ಆಲಿಸು ಗೆಳೆಯನ ಹೃದಯದ ಮಾತೊಂದ, ಬಿಚ್ಚಿಡು ಬಚ್ಚಿಟ್ಟ ಮನದ ಕನಸೊಂದ. ಹಿಂದೆ ಸಮಯ ಮುಂದೆ ಇಡಲು ನಮ್ಮ ಹೆಜ್ಜೆಯ, ನಿನ್ನ ಸಾಹಸ ರಥಕ್ಕೆ ಸಾರಥಿಯಾಗಿ ಮುನ್ನಡೆಸಿದೆ. ನಿನ್ನ ಬಾನಂಗಳ ಕೆಳಗೊಯ್ಯುವ ರೆಕ್ಕೆಯಾಗಿ ಕೂಡಿದೆ. ಬೆಂಗಳೂರು ವಾಯ್ಸ್, ಬೆಂಗಳೂರು ವಾಯ್ಸ್.
Bengaluru Voice. Listen to your heart.